There is a way through this. We all need to keep going. I need all of you to keep going. And we're going to keep going to keep Australia running. All Australians have a role to play as we make our way through. And there is a way through. There is a bridge over this. And if we continue to work together in the way we are all around the country, then Australia will bounce back strongly. You will bounce back strongly, your family, your business, your community. There is a way through. Life is continuing to change, and together we are going to have to continue to adapt to those changes to keep Australia running. Australians, we will all continue to see more information. There will be additional cases. This is something we should be continuing to expect. This is anticipated. The presence of additional cases is not something of itself that should cause alarm, because at the end of the day, you don't stop this virus, but you can defeat it by slowing it down. And that is how we save lives. Today, the National Cabinet met again on our commitment to work together to keep Australians healthy as we can, to protect them, and to ensure that we keep Australia running together. Today, we made further decisions, many of which we have flagged from our last meeting, that are both scalable and sustainable to ensure that we can continue to implement for the many months ahead. As I've said, we're looking at least 6 months to be working through over the course of this year. Of course, it could be longer. No one really knows. But we're taking decisions on the basis that we need to move at least through the next 6 months. At today's meeting, it began with us focusing on the economic issues and with a presentation of the Reserve Bank Governor, Dr Lowe, who briefed Premiers, the Chief Minister and myself on the measures that were announced yesterday, as well as providing a general overview of how the Reserve Bank was seeing the economy and the impacts, and this was also done by the Federal Treasury through Dr Kennedy, who provided the same advice. We were able to share information between states and territories on what we were each doing to provide support in our economies, the various stimulus initiatives that have already been announced, and further work we were doing together to ensure that we could provide further support. Now, as you know, as I said here with the Treasurer yesterday, we are working on a package that will cushion the blow over the next 6 months and will provide the necessary support so people can get on that bridge to get them to the other side. That is focusing heavily on small, medium-sized businesses, sole traders, and it is also providing for the income support that will be necessary for those most directly impacted by the economic downturn caused by the coronavirus. I want to particularly welcome the decision, which the Treasurer will go into in more detail, that was made by the banks today, which showed that they are pulling together with everyone else to ensure that we can get Australians through this. These are important decisions that will provide real and genuine relief. It's a great start, and we will continue to work closely with the banks and all others to ensure we all work together to provide the most support to Australians as we can to get them through this over the next 6 months at least. States also agreed today, and further work will be done on this, working to identify how relief can be provided for tenants in both commercial tenancies and residential tenancies, to ensure that in hardship conditions there will be relief that will be available, and ensuring that tenancy legislation is protecting those tenants over the next 6 months at least. That work will be done by states and territories, as it is a state and territory matter, and that work will be led by Western Australia together with New South Wales, working with all the other states and territories to bring back some model rules that can be applied in hardship cases. So understanding what the trigger might be and how in those circumstances that tenants would be able to maintain their tenancies. Now, I know that will mean something for landlords, just as the decision taken today means something for banks. Just like the decisions we have already taken as a Commonwealth Government means things for our balance sheets and as a people for the Commonwealth Government, as it does for the states. It will also mean something for those who sadly might be stood down from their employment and have to look at their annual leave arrangements and sick leave arrangements. All Australians are going to be making sacrifices, obviously, in the months ahead, and everyone does have that role to play, and that will include landlords at the end of the day for people who are enduring real hardship. It was also agreed today that putting budgets together at this time, with the great uncertainty that exists, is not something that any Commonwealth or state government should be doing. As a result, we have already decided that we will not be now handing down a budget until the first Tuesday in October, on the 6th of October. The Treasurer will be having a bit more to say about that. All other states and territories will be working to similar timetables. The idea that you can actually put together any sort of forecasts around the economy at this time is simply not sensible, and as a result we will be putting in place the necessary measures with the support of the Parliament on supply and other continuances to ensure the proper functioning of government services and the continuation of vital programs. On Sunday, I will be meeting with the Leader of the Opposition and the leaderships of both the government and the opposition. I spoke to him earlier about this today, and we'll be working through those practical issues around the functioning of the Parliament, both now and over the next 6 months. And I thank the Leader of the Opposition for his support on those arrangements as we work them through. On health, and I ask you to bear with me as we go through this, and Dr Murphy will be joining us to answer questions, also make some statements on these matters. The rise in the number of cases means we need to continue to take action to suppress the growth in these cases and to flatten the curve, which is something more Australians are becoming more familiar with. That means we've got to work even harder to keep a healthy distance between us all. We agreed to further rules today regarding indoor non-essential gatherings. Earlier, I announced the 100 limit on non-essential indoor gatherings, and I went through the list of those things that were essential. I won't do that again today. It's the same list. But what we are now moving to is an arrangement for gatherings of less than 100, is that there would be 4 square metres provided per person in an enclosed space, in a room. So that's 2 metres by 2 metres. So, for example, if you've got a room, if you've got a premise, if you've got a meeting room or something like that that's 100 square metres, then you can have 25 people in that room. Now, in addition to that, you should continue to practice wherever possible the metre and a half of healthy distance between each of us to ensure that we are limiting the contact and limiting the potential for the spread of the virus. Now, these are quite practical rules. Out there in the community, whether it's licensing laws or fire laws or anything like this, there are already these types of arrangements. The number of people who can be in outdoor seated areas, that relates to noise controls. So these, I think, are very practical and sensible arrangements that venues and others and commercial premises and in public premises that we can manage. It just simply means understanding how big the room is and then simply advising how many people can be in that room at any one time. And we'd also be seeking the cooperation of patrons and others to ensure that they can do the same thing. If you're looking after your behaviour, you're saving lives. You're helping other people who are more vulnerable. In many cases, for the young and the healthy, it is true that the majority of cases, 8 out of 10, people only have a mild illness. But if younger people in particular, and those more generally in the community, follows these rules, it won't be your life you're saving because you'll be fine, you'll be healthy. But by you doing the right thing, you'll be saving the life of someone who is more vulnerable. So do it for your fellow Australians. I know these rules will take some time for people to get used to, but I'd ask people to move as quickly as they can. I know it means a lot of change for a lot of venues, whether they be cafes or restaurants or clubs or any of these other places of public gathering, including in this building here. We'll be working to ensure that people know how many people can be in the various meeting rooms in this place. Next week, the Parliament will have less than 100 people in it at any one time in the chamber. So even in essential areas, it is practical to try and observe these, but that won't always be possible. For essential gatherings, they have an even higher purpose, and in some cases that will be more difficult to implement. But if we do it more broadly, then we're slowing the rate and we are saving lives. I also want to make the point that self-isolation means self-isolation, and Dr. Murphy will be speaking more about that issue. We are hearing reports of some who are saying they're in self-isolation and they're out and about. Self-isolation means exactly that. For older residents also, earlier this week we also provided the advice through the AHPPC, through the medical experts panel, that older residents should be refraining more from public contact than others in the community. That doesn't mean they need to self-isolate, it just means that they should practice greater caution than those else otherwise in the population. Now on travel, there'll be further discussion about travel issues before the school holidays. The National Cabinet is now meeting every Tuesday night and every Friday morning. That's what we've done this week, and we think that's a good rhythm of meetings to ensure we can consider all the recommendations that are coming up through our various agencies. The advice is to reconsider the need for unnecessary travel. And if you're unwell, stay at home, unless seeking medical advice. Further advice is being taken to the National Cabinet next Tuesday night, and that will be available before people go on school holidays. And so we'll be considering those issues further, and I'm just flagging that for next week when we consider those issues on a broader scale. In relation to schools and preschools, the situation has not changed. It is in the national interest to ensure that we keep schools open. I want to thank all of those schools who have been putting those arrangements in place. For those schools who have moved to distance learning for their students, I want to thank those schools who have ensured that even in those circumstances, they have arranged for students of parents who have essential responsibilities. They may be nurses or doctors, childcare workers, they may be teachers themselves. They are providing for the students to be able to continue to receive lessons in that facility, and that is what we want to see happen. On aged care, the government, the Commonwealth Government, made a number of decisions yesterday and to further support the workforce in aged care. We are providing $444.6 million, say that again, we're providing $444.6 million of additional funding from the Commonwealth to support aged care facilities. Now that is on top of the more than $100 million that I announced last week in relation to workforce support across the country for aged care. That includes $234.9 million for a retention bonus to ensure the continuity of the workforce for staff in both residential and home care. There's $78.3 million in additional funding for residential care to support continuity of workforce supply. There is $26.9 million to supplement the viability of residential aged care facilities, including for National Torres Strait Islander Aged Care Program and the Multi-Purpose Services and Homeless Providers. There's $92.2 million being provided in additional support for home care providers and organisations which deliver the Commonwealth Home Support Program, including for services such as Meals on Wheels, and $12.3 million to support the My Aged Care Service to respond to the needs of older Australians. National Cabinet agreed that states and territories will also issue nationally consistent public health directions on visitor restrictions for aged care facilities to complement the regulatory standards adopted by the Commonwealth. This additional funding is being focused on those who are most vulnerable to get them the additional support so they can get access to the essential things they need, particularly through things like Meals on Wheels and home care support and the other things older Australians will need going through this time. Another very significant issue which I flagged earlier in the week that we'd be considering is in relation to remote Indigenous Australian areas. Under the Biosecurity Act, we'll be using the Health Minister's powers to ensure that we're taking action to restrict travel into remote Indigenous communities to prevent the spread of the coronavirus. The way this will work is states and territories will nominate prescribed areas, that is communities, in consultation with Indigenous communities as an emergency requirement as determined under the Biosecurity Act that will restrict persons from entering or leaving those prescribed areas. Now, there will be a number of exemptions that will apply for the purposes of obtaining medical care or medical supplies into those communities. In the event of an emergency, including the purposes of providing medical care, that would include things like Medivac of cases or others who are seriously ill from those communities. for the purpose of supplying or undertaking critical services such as medical care for mental health or domestic violence support, police and emergency services, food and medical supplies, educational and maintenance and repairs of essential services. And there are a range of other measures there which are done at the discretion also of the relevant exempting authority in those states and territories. So that will be a further important set of measures, and I particularly want to commend Minister Wyatt and Chief Minister Gunner up in the Northern Territory. Working together, they've done an outstanding job in working through those issues, consulting with Indigenous leaders where they can, but you'd understand, given the urgency of this issue, that consultation has had to be quite short-circuited. I want to thank people like Pat Turner and others who've been very helpful in working with ministers to come to these appropriate arrangements. As you can see, again, another long list of issues discussed today. There are also issues discussed relating to prison populations, as well as coordinating action in relation to supermarket supplies, food chains and supply chains across the community, and that is everything from a consistency of tracking laws to enable deliveries at any time of the day. We appreciate all the states and territories moving on those issues, on trading hours arrangements, and again the states being very constructive when it comes to those matters. What's next? Where do we go next? What are we considering? Well, as I said, on Tuesday night we'll be considering further decisions on travel advice prior to the school holidays. There'll be further advice on managing critical hospital resources. An enormous amount of work has been done there. There is work we've tasked to the medical expert panel about what we would call localised responses. Now, bear with me as I just make this point. There will be, as we have already seen, parts of cities or places that will be more susceptible because of quite localised outbreaks. What we've asked for advice on is the density of those cases, how many cases in a particular area that triggers actions over and above what these general rules are that apply to those areas. And that would be staged up according to the level of that outbreak and what needs to be done wherever possible to shut that down. Now, the reason I say that is we need a consistent approach to how this would scale up in the event of outbreaks in particular parts of particular areas. Because that means just because you might see under those rules something being done in Tuggeranong or in Tamarama or anywhere else, that doesn't mean those rules need to necessarily apply in Guyamea Bay or down in Hawthorn or anywhere else. Where there are more specific outbreaks, there will be more advanced measures that would need to be put in place, and we want a clear set of rules across the country to support states and territories to make those rules, and that advice will be coming forward on Tuesday evening. We'll also be considering the needs of other vulnerable groups. We've been focused on aged care and remote Indigenous populations, but the Minister for the NDIS has been doing an extraordinary amount of work with the disability community, and we're expecting further work to come forward on that, as well as more general discussions about maintaining continuity of supply and essential services in areas like telecommunications and energy and so on. But I must say at this point, the reports and advice that I've been receiving on these issues is at a reasonable level, and better than that, I'd have to say. But as time goes on, we'll keep a close watch on that. So I thank you for your patience again. I'm going to pass you over to the Treasurer to make some comments on the measures put in place by the banks, and then Brendan, Dr Murphy, will speak on the matters I've raised, and they're happy to take questions, and I'll get round everybody as best as possible.